Welcome to I Heart My Health TV broadcast, a weekly publication to really bring to you news and reports from Methodist Healthcare North. My name is Gyasi Chisley, CEO.
And I'm Jonathan Watkins, Chief Operating Officer at Methodist North.
We're thrilled that you could join us today because we'll really be talking about what differentiates us from other health systems around the country. It's truly our mission, vision, and core values. John?
Our core values are things that we truly intend to live by within the Methodist healthcare system, and Methodist North really strives to bring that home. Our core values are service, teamwork, integrity, quality, and innovation. We truly embrace each of those, and we encourage our associates to live by them. For the last several years, we've ensured that we have guided our associates in that direction. In fact, we recently began offering, administering a competition in which departments within our hospital can apply for awards tied to each of those core values. You know, the performance excellence in innovation, performance excellence in teamwork. And again, not only it's aimed at consistently getting us to display those, but us to a message Gyasi likes to make sure we do, proliferating the message, talking about it, touting our successes. So again, those are all things we're working to make sure we do. I want to share that with you during this broadcast.
And we've got a responsibility to execute our mission each and every day. We really want to make sure that our mission is at the forefront of everything that we do. Our patients, our associates, everybody in the community has worked with us and partnered with us successfully, I might add, to really make sure that, again, we promote and proliferate that mission. Right. I want to talk to you today a little bit about our mission. So we're going to have some very, very special guests that I'll let Jonathan talk to you about in a second. But it's really an opportunity for us to help you understand why we're so mission-driven. Every dollar, every cent that we make, we really want to pour back into the facility just to make sure that our mission lives and breathes and has an opportunity to thrive. One of our core values is innovation. So we're really getting very innovative, very creative on what we're planning to do in and throughout the community. Again, breaking outside of the four walls of the hospital to make sure that our mission lives and breathes.
As Gyasi mentioned, one of the things we do try to ensure that we do is pour the resources and the revenue, whatever we generate, back into the facility. In 2011, we began a house-wide renovation project in which we started to pour that money back into the facility to upgrade the look and feel of the hospital. It was dated. We had the big box televisions that probably no one owns right now. But what we wanted to go through is to make the hospital more of a home for our patients, to make it more comfortable, so that it was, as we talk about it and we try to live, a more patient and family-centered care environment. Today, we'll have joining us members of our Congregational Health Network. Our Congregational Health Network has been established for several years now, and it truly works at getting out into the community, developing those relationships, proliferating the message that we want to embody in terms of our mission, our vision, and our values.
Absolutely. And just to talk about our vision a little bit before we go into our guests, our vision is to really be nationally recognized and really promote our mission on a broad basis. We're starting to execute that vision. We might have to get a new vision, Jonathan, because we're starting to realize that vision. You never want to achieve your actual vision. You want it to be very, very lofty. But one of the things that we're proud about is that we have been recognized in several publications, U.S. News and World Report, throughout the region. We're the market share leader, so we're proud about that.
We are. We're also extremely proud of the certifications that we've received. We received several disease-specific certifications for hip and knee, joint replacement, AMI, basically heart attack, heart failure, as well as pneumonia. Treating those patients, we've been deemed and designated by the Joint Commission as a center of excellence in many of those areas.
That's fantastic. So what does that mean to you? That means that we're bringing care to you and that we are being nationally recognized for the care that we provide. So we're excited about that.
We truly are. We have world-class physicians on board. We have outstanding associates, many of which, again, have been recognized and are doing a lot of great things in the community. So this is just going to be a forum for us to share some of these things with you.
And finally, we want to talk to you a little bit about our approach. Recently, I think maybe about 3 or 4 years ago, Jonathan, now, we engaged on a journey to really ensure that all 11,000 of our associates at Methodist Lebanon Healthcare and all 1,216 of our associates at Methodist Healthcare North work and engage the patient and their families and our community in the same manner. So our tagline is MLH. It stands for Methodist Lebanon Healthcare, obviously, but it also stands for, well, how we we approach and engage our patient care. It stands for making the connection, listening to understand needs, and honoring our commitments. We feel that if we do those three things well, that we'll be ahead of the game.
So what does that look like, making the connection? When an individual or a patient or a family member or a guest in our facility comes, we truly want to connect with that person on a one-on-one basis. We want to try to really emotionally figure out what it is that's bothering them and how we can best treat that patient or that individual. We want to listen to their needs. We want to truly pay attention, not to what we think they need, not to what we think they want, but we want to find out what it is that's most important to them. And then lastly, we want to honor our commitments, the H in MLH. If we say we're going to do something, we want to make sure that we do it. And today I actually had an interesting encounter with the patient, visiting him, talking to him about the services we provide, and asked him how could we best service him or best take care of him. What's important to him? He told me his eye drops were important. Something as small as his eye drops. We've been making sure that he's recovering from a hip replacement, that he's doing well, but when he actually, in actuality, all he wanted was eye drops.
Eye drops, wow.
You know, so again, making that connection with him during a casual conversation, definitely listening to his needs, and I honored my commitment by ensuring that he did.
That he got his eye drops.
So again, things as small as that, when you're in a healthcare institution, eye drops, you know, water, ice, all those little comforts that you sometimes need and we take for granted are really what individuals and patients want.
And that's what separates Methodist Healthcare North from any other institution in and throughout our region. So from our EVS staff to our respiratory staff to our physicians to administrators, lowly administrators, we definitely MLH and make it a verb and not a noun. We make sure that we're making the connection, listening to understand needs, and honoring our commitments. So who do we have on the show today, John?
We have two gems that are truly, I think, outstanding at MLHing the community as well as the individuals within the hospital. Chaplain Steve Miller is going to be joining us today, who'll talk to you a little bit about his background. Awesome. And Sheila Easterling-Smith, she's our Congregational Health Navigator. She works out in the community with the local congregations and the clergymen in the city, helping promote what we're doing here.
Fantastic.
Really excited about having them on board.
Wonderful, wonderful. So one of the things that the next segment, we'll talk to Chaplain Steve Miller, who is our Director of Mission Services at Methodist Healthcare North, does a fantastic job for us, and he has an amazing story. We'll be right back with him.
Is your event powered by Black Market Strategies? Theirs was Black Market Strategies, the new face of urban marketing. Let us plan your next big event or design that special flyer. Black Market Strategies specializes in street team deployment, flyer distribution, target marketing, product and event promotions, marketing and brand awareness, campaigns and election strategies. But wait, there's more. Media relations and solutions, business strategies, community marketing. We promote people, product, events, and brands. Is your event powered by Black Market Strategies? Give us a call today. 901-379-9101.
Please support the Fresh Starts Community Baby Shower through your donation of a new baby item. I am State Representative Antonio Parkinson, and this is Kalani, and we approve this message.
Skinny Fiber works. I've got my Skinny Fiber. Have you got yours? If you need to drop 5 pounds quickly, Skinny Fiber works. If you need to get in that little black dress, Skinny Fiber works. Skinny Fiber lets you eat less and feel full. It's 100% all natural. It detoxifies the body, improves blood sugar imbalances, and melts away stubborn fat. Get yours today. For more information, call 901-860-5110. Or you may check out our website at www.skinnyuniverse.com.
Black Market TV.
Welcome back to I Heart My Health. My name is Gyasi Chisley. I'm joined again with Jonathan Watkins, our COO, and we've got a very, very special guest, as we told you about in the last segment, Chaplain Steve Miller. How are you, Chaplain?
Doing great, thank you.
Good. Well, thank you so much for joining us. Really appreciate it. You've got a very interesting story and background. Would you tell us a little bit about it?
Sure. I grew up in Tipton County, along the Mississippi River, about 40 miles north of here, and in a very agrarian society. Lived on a farm, and very involved in the farm life. I did 4-H Club, I did Future Farmers, And I actually went to school at Tennessee State University and majored in animal science.
Wonderful.
And
Isn't that like an awesome school?
it is. It's a great school. Great school.
Jonathan's alma mater as well, yes.
And I ended up getting recruited by a company named Agway.
Agway, okay.
Agway in Pennsylvania. And did that for a couple of years, came back to Tennessee. And but during that time, I got a call to ministry. And I have several ministers in my family. My grandfather, his brother, just several ministers.
So were they surprised when you got called?
I was surprised, but they told me that they were not
They
surprised.
always knew.
Really?
Yeah, yeah.
And I really did run from that. I wanted to do veterinarian medicine.
Okay.
Oh, wow.
And, so ended up.
So they saw the preacher in you.
Yeah. And I guess I kind of look at it that I get a chance to be an under shepherd over God's sheep. And so, but just a very great experience. I came into the ministry, had a lot of great mentors who really nurtured me and took me through the process, receiving an ordination, and pastored. I've pastored. I'm pastoring the third congregation now, North Star Community Church, which that we founded about 16 years ago. But before,
And where's that located, Steve?
that's here in Raleigh.
Yeah.
It's here in the Raleigh area.
Part of our primary service area?
And a lot of great people. It's a wonderful place to be. And part of the preparation for doing this was when I was in seminary. I left seminary coming to Methodist Hospital, and they had a program called Clinical Pastoral Education. And really, what it did for me, it really helped me to learn about me, and all of the things that helped me to become who I am, and also those things that were in my closet, those things that shaped and formed me, all the significant events in my life. And there were some things I even had to go back and relive and process, get some healing in my past, because I found out that if I didn't get healed in my past, then I would bring my woundedness into my present. And so I'm so grateful for that experience, and I would just encourage anybody who's in professional ministry to certainly consider that.
Sure.
And that led me to chaplaincy. After doing the CPE for a year.
Now talk to us a little about CPE. When you say what's
Clinical Pastoral Education. And I was in a resident program.
Oh, okay.
Along with about 5 peers and a supervisor. And we visited patients. And we did a lot of hospital visitations. We learned how to deal with things like death. And the good thing about it is that we did that alongside the scriptures. When we read the scriptures, like we read Psalms, we often think of the songs, but if we read it very closely, there are a lot of laments.
Right.
Okay.
You know, David was being pursued. Even though he was anointed as king, he didn't assume that position readily.
Right.
And he was being, even by Saul, who was already king, tried to kill him.
So even for ordained ministers, there's a training that you go through in order to become a hospital chaplain.
Yeah, and one of the things that I didn't realize was that I thought that because I was an ordained minister and I came to the hospital and I prayed for people and I read scripture.
You were ready to be chaplain.
Why would I have to come and do this for a whole year?
Right.
But once I got into the program and began to learn again about something like a lament, that David lamented.
Sure.
And what it did, it taught me how to listen to the lament in patience.
And we talked about listening in the last segment and part of our MLH strategy.
And that is really the greatest gift that a chaplain brings, is the ability to listen and to not only to what's said, but what the meaning behind what's said. And even sometimes what's not said.
The implicit. Absolutely.
And the interesting thing about it is that we will know when we've been listened to.
Yes.
We'll know when somebody spends time with us. And one of the things that I try to do when I have prayer with patients is I try to lift up the concerns that they have brought forward.
Right.
And they get a chance to hear it. They realize that I listen. And if you don't think listening is important, if you call a psychiatrist and you find that you got a 6-month wait and it's $175 an hour, you understand. People really want to be listened to.
They want to, yes.
They're paying good money to be
And need to.
They
need to.
really do.
Yeah.
They really need to be listened to. And here's an interesting thing. The scripture says that we'd confess our faults one to another and pray one for another that we might be healed. And really what I'm saying, sometimes our healing is in our confession. And in order to confess, we really need somebody to hear our confession.
Absolutely.
And so sometimes all healing is not medicinal. Sometimes some of the healing is spiritual, emotional, psychological. And sometimes a good listener can really help us through the process.
And that's part of our mission, right, Steve? I mean, is that we are not just in the physical well-being and physical health, but
Right.
we really want to promote spiritual and emotional health as well.
Right. And really, if I come into the hospital and I'm physically healed and physically sound, but if I'm emotionally fractured
Right.
and spiritually separated and wounded, then I'm not whole.
Right.
You know, I make it past the physical exam, but as an individual. And so our mission is really about healing the whole person.
Yeah.
The whole person.
Yeah.
And so we certainly attempt to do that. And one of the ways that we do that is that we have chaplains at all of our hospitals. And we provide spiritual care, and it's available 7 days a week, 24 hours a day. And not just in crisis.
Right.
In the situation where there's an accident or impending death, but we also, somebody may just want prayer before surgery.
Right.
Or maybe they need a Bible or a devotional material, or maybe what we can do is help them to contact somebody of their particular faith.
Yes.
You know, Memphis is a great crossroad. That we have an airport, we have a couple of interstates coming through the city. We have some places that people come to visit, and sometimes while people are here, they get sick.
Right.
Yes.
And they don't know anybody in the area.
Yeah.
So what we'll do, we'll facilitate and we'll make connections out in our faith community and have those individuals to come in and to provide the ministry within the walls of our hospital.
Right. That's wonderful.
So Chaplain Miller, is healthcare providers, we're oftentimes on the receiving end of everyone's burden, of everyone's illness. And we see a lot, when I say we, the Methodist Healthcare family, Methodist North family, how does your team interact with the family in making sure that we're spiritually sound, that we're okay? Do you all offer any services to the Methodist North Associates?
We do. And what we do is that we have a chapel that's always open. And while we're visiting on the floors, we're interacting with our associates.
Sure.
And so we get to know them and we spend personal time with them. And all the things that happen outside of the hospital, people have illnesses, divorces happen, children get in trouble. And so we do provide ministry. And if we can help our associates to be healed, then they can in turn help our patients to be healed.
Absolutely, absolutely. We think that's key to our patient experience. Exactly.
It is.
Okay,
It
okay.
is.
So talk to me a little bit as we sort of close this segment about your role and how you view your role.
Well, I view my role, I see that the hospital is literally my parish. And I'm here, and that these individuals, our patients, our guests, our family members, our associates, whoever come within our walls, that I'm here to provide that care for them. It's kind of like being their pastor away from home. If they like to be ministered to, then I try to provide that ministry while they're in the hospital. And then if they don't have a home in the community, a spiritual, a faith home, then I'll try to connect them with pastors who live in the community, in the general vicinity. So I'll try to do that.
Awesome, awesome. Well, as we're closing this segment, we'll be right back. And Steve, can you join us for a couple minutes here?
I'd be glad to.
Wonderful. We had a big week a couple of weeks ago at Methodist Healthcare North with our Week of Blessing, and I want Steve to kind of touch on that if he could. So we'll be right back with those details. You're in for a treat.
Is your event powered by Black Market Strategies? Theirs was Black Market Strategies, the new face of urban marketing. Let us plan your next big event or design that special flyer. Black Market Strategies specializes in street team deployment, flyer distribution, target marketing, product and event promotions, marketing and brand awareness, campaigns and election strategies. But wait, there's more. Media relations and solutions, business strategies, community marketing. We promote people, product, events, and brands. Is your event powered by Black Market Strategies? Give us a call today, 901-379-9101.
Please support the Fresh Starts Community Baby Shower through your donation of a new baby item. I am State Representative Antonio Parkinson, and this is Kalani, and we approve this message.
Skinny Fiber works. I've got my Skinny Fiber. Have you got yours? If you need to drop 5 pounds quickly, Skinny Fiber works. If you need to get in that little black dress, Skinny Fiber works. Skinny Fiber lets you eat less and feel full. It's 100% all natural. It detoxifies the body, improves blood sugar imbalances, and melts away stubborn fat. Get yours today. For more information, call 901-860-5110. Or you may check out our website at www.skinnyuniverse.com.
Black Market TV.
All right, welcome back to I Heart My Health. We're still joined by Chaplain Miller, who's been sharing with us a lot of information about his journey into the spiritual care world as a chaplain within the Methodist North family, as well as his background, which I found extremely interesting.
Very.
As we were closing, Gyasi referenced the Methodist North's Week of Blessing. Talk to us a little about that and what inspired it, how you came up with the thought, the idea, and just what it was.
The Week of Blessing was a way for the church and the community to be involved in the special event. And the special event was having Gyasi as our CEO and having you, Jonathan, as our COO. And we just thought this was such a tremendous blessing for our community. We've got 2 young, bright, capable individuals who we certainly see as role models. Mm-hmm. And one of the things we wanted to do, we wanted the church, since we are a faith-based institution, we wanted the church to bless you all. And we really believe that you being here is God ordained, that God has selected you and put you in this context at this time in history so that he can promote health and healing and well-being into this community. And I think that the 2 of you being here is really the result of a lot of prayers. And so we wanted to not just keep this secret within our 4 walls, but we wanted to invite our Congregational Health Network partners, our local pastors, our educational leaders, and just all those individuals who support us and interact with us on a daily basis. We wanted them to be part of this too. And so what we did, we had a consecration service, had a lot of our local clergy involved, had Craig Munt School came, and their young people did a wonderful job.
They did,
and providing music. And we had a real consecration service, a real service, yes.
Yeah, so, and it's funny you mentioned that. So explain what a consecration is. My family was talking about it and mentioned it to my nephew, and my nephew said, "Oh, you got confirmed."
Well, there's a difference between a confirmation and a consecration.
Right.
A consecration really means that you're set apart for special use or special purpose. And if you go into a local church, maybe you find there's a chalice or there's a communion ware, and that is used, or maybe there are even vestments, a robe that are used for special occasions. They've been set apart, dedicated to God. And that's really what we see you guys as, that you guys are set apart, that you're dedicated to God. And that's what the consecration service was about. And so, again, we had some of our leaders, Mr. Shorb and Mr. Yagwiki, were here, and certainly had some of our leaders at Methodist North participate, just from a variety of people, to let you know that the whole hospital believed in you and that they wanted to confer a blessing on you. So it was a great event. It was well attended. I was so glad to see your parents here, your wife, your daughter, your wife was here, and your mom. Yeah, so your mom here too. So just the family support, and that really is the way that a consecration service is supposed to be.
Absolutely.
Those that love us and have been part of our nurture, where they get a chance to come and see us being the blessings of God being bestowed upon us.
So that was.
We can't thank you enough for that. I mean, it was truly just an awesome experience to be a part of.
It really was.
We want to thank you.
Thank you.
And you see what it did for Dr. Yaguiki.
Yeah, he's gone on and really, yes.
So am I going to be going on like that? We can talk about
We believe that. We certainly believe that.
Glad we're consecrated. Well, we're having so much fun with you. Would you stay with us for a couple more minutes?
I would be.
And Chaplain Miller gets a little verbose because he's a preacher, but we're going to ask him to come back. And what we want to talk to you about next is just your team, your vision for Methodist Healthcare North. Again, our mission is our differentiator. So we'll be right back and we'll talk to you a little bit more about that. Sound good?
Sounds great.
We'll be right back.
Is your event powered by Black Market Strategies? Theirs was Black Market Strategies, the new face of urban marketing. Let us plan your next big event or design that special flyer. Black Market Strategies specializes in street team deployment, flyer distribution, target marketing, product and event promotions, marketing and brand awareness, campaigns and election strategies. But wait, there's more. Media relations and solutions, business strategies, community marketing. We promote people, product, events, and brands. Is your event powered by Black Market Strategies? Give us a call today. 901-379-9101.
Please support the Fresh Starts Community Baby Shower through your donation of a new baby item. I am State Representative Antonio Parkinson, and this is Kalani, and we approve this message.
Skinny Fiber works. I've got my Skinny Fiber. Have you got yours? If you need to drop 5 pounds quickly, Skinny Fiber works. If you need to get in that little black dress, Skinny Fiber works. Skinny Fiber lets you eat less and feel full. It's 100% all natural. It detoxifies the body, improves blood sugar imbalances, and melts away stubborn fat. Get yours today. For more information, call 901-860-5110. Or you may check out our website at www.skinnyuniverse.com.
Black Market TV.
Welcome back to I Heart My Health. I'm joined again by Jonathan Watkins and Chaplain Steve Miller. Chaplain Miller, would you talk to us a little bit more about sort of your vision for the hospital and what you're doing to sort of execute that vision with your team?
I think the main vision is to make sure we carry out the social principles of the United Methodist Church. And we have a great team to help us to do that. Dennis McDuffie, who has been there almost 20 years.
Yes.
I've been with the system for 20 years. And Chaplain Evelyn Seal, who's just a real gentle spirit,
Yes.
A very godly woman, certainly a prayer warrior.
Yes.
And then we also work in conjunction with our members of our Congregational Health Network, Sheila, Easterling-Smith, and Brad Thomas. And one of the things that I'm really proud about is that the way they've been able to reach out into our community and to network with some of our local faith leaders. And they've done a tremendous job in that. And we have a lot of participation from our clergy as well as our lay individuals who come into the hospital. And we have had, recently, we've had a great influx of volunteers. And some of them are lay folks, and some of them are ordained. But what they've discovered is that they have a ministry that even goes outside of the walls of the church.
Right.
And so, and one of the ways they get a chance to carry that ministry out is that they take a basic class called Congregational Care and Visitation, which actually provide the skill sets to visit. Now, whether an individual wants to just be a visitor for the members of their congregation, that's fine, but some of them actually want to just help visit folks inside the hospital.
Wow.
And we have some people who are not connected. They don't have family. They don't have friends. They don't have the social support. And so they can be relatively lonely. And so we have individuals who on a daily basis provide spiritual care, whatever that particular need is, whether it's communion, a prayer, or sharing some devotionals, or reading scripture, or sometimes just helping to discern where God is in the midst of their illness. And so we have a great team, and it's growing, and I'm so very proud of it.
Sounds like a very powerful team, too.
It is a very powerful team, and they do so much behind the scenes. And I'll have to say this about our team. Our team, they're very humble, and they're never going to toot their own horn. And so one of the things that they do that I think is noticeable is that they help us to follow the Christian year in the hospital.
Right.
And so when there are programs, whether it's All Saints Day or World Day of Prayer, or we're celebrating Dr. King's birthday, Ash Wednesday, our staff arranges for they give a lot of thought into those programs and make sure they're very well prepared, and they make sure that they're open for our associates and our guests in the hospital. They also they do a lot of teaching.
Yes.
And really we use them almost as staff, as facilitators. They have a lot of skill, a lot of training. All of our chaplains will have a master's level degree from an accredited seminary. And then they have to do 16 hours of CPE. And generally they do another year of 16 hours of CPE. And then they also apply for certification. So our chaplains they're board certified.
Wow.
And able to teach on a variety of subjects, everything from stress to conflict. They're able to conduct workshops, to facilitate, just again, on a variety of subjects. And also act in any kind of crisis that happens. So whether it's an Emory house where a patient has stopped breathing, and they know how to be with family members and help facilitate all the things that happen. And there are a lot of things that happen during a crisis event. And you'll find those calm, dedicated spirits right there, right in the midst of all that's going on, providing good spiritual care.
So if there's anyone out there in TV land interested in becoming a volunteer, how do they get involved in supporting our spiritual care team?
Probably the first step would be if they would just call the hospital. They can call the hospital and ask for the chaplain's office. And what we would do is, in conjunction with our Congregational Health Care, we would arrange for them to take a basic class to give them the skill sets that they have, that they need in order to do the ministry. And again, it's, and then from that point, after they complete that, they would fill out an application. And then we would interview them, and then if things go well, then they would proceed in the process. And actually, they can work at any hospital that's closer to them, whichever one is most convenient.
Whichever in the network.
They set their own hours and their own days that they want to come. And we will provide the training, and we will make sure that they're comfortable. And then once they're comfortable, then we allow them to go throughout the hospital.
And again, just reiterating, you do not necessarily have to be a minister or a deacon in your church. You can be like,
you can be a layperson.
Like me.
Right. Like a layperson. And actually what I would do, and I would encourage pastors, if you have a team of deacons or stewards, or if you have ministers in your church and maybe they don't have responsibilities, send them to us and let us train them. And they can help work in your local church, and then if they decide that they want to come
Community
to the hospital,
service, absolutely.
then we'll make a place for them also to work in the hospital.
That's wonderful.
That's fantastic.
But again, we can provide the training and help them to develop the skill sets that they'll need.
Would you talk a little bit about, because they report to you as well in the hospital, who we commonly refer to and affectionately refer to our key men and our pink ladies?
Yeah, we have the key men and pink ladies, and it's really amazing that we have individuals who volunteered for over 30 years. And our key ladies, what they do, they're generally at our front door. They greet our patients, they greet our family members, and actually help them to find rooms of their loved ones, provide directions throughout the hospital, all those things that just make access easier. And our key men, they've been very helpful and helping to transport patients and really anything that we've asked them to do. They're certainly willing, and they come early in the morning.
They sure do.
7 o'clock in the morning.
They are there.
They're there, and they come rain, shine, sleet, or snow. They're there. They are dependable and trustworthy, and I'm just amazed that of the volunteers. But
We are as well.
Really is the volunteer state.
It is the volunteer state.
We can say amen to that.
Amen.
We have some wonderful volunteers here, and actually, and some of our volunteers are have actually reached the age of 90.
Yes.
And they still
And some are former patients,
former
which
patients,
is fantastic, and we welcome them back into the facility. Well, so as we close this segment, and again, thank you so much for being here, Chaplain Miller. What about how does this separate us? Our mission is in everything that we do. It's at the heart of what we do.
That's who we are.
You've seen it in and throughout the community. You pastor a church, but how does our mission truly separate us in your mind?
Well, I think one of the things that happen is that we're able to live it out. And so we don't ask you to park your faith or your spirituality at the door when you come into the hospital to work. We actually help individuals who work within our system to use that, and it enables them to either to do a better job.
Yeah, absolutely. Well, we're thrilled about this. We'll talk to you a little bit later on. We want to go and pivot to Sheila Easterling-Smith, who you spoke about so eloquently. She is our Congregational Health Navigator and does a fantastic job for us. We'll bring her up and we'll talk a little bit about our CHN after this.
Is your event powered by Black Market Strategies? Theirs was Black Market Strategies, the new face of urban marketing. Let us plan your next big event or design that special flyer. Black Market Strategies specializes in street team deployment, flyer distribution, target marketing, product and event promotions, marketing and brand awareness, campaigns and election strategies. But wait, there's more. Media relations and solutions, business strategies, community marketing. We promote people, product, events, and brands. Is your event powered by Black Market Strategies? Give us a call today. 901-379-9101.
Please support the Fresh Starts Community Baby Shower through your donation of a new baby item. I am State Representative Antonio Parkinson, and this is Kalani, and we approve this message.
Skinny Fiber works. I've got my Skinny Fiber. Have you got yours? If you need to drop 5 pounds quickly, Skinny Fiber works. If you need to get in that little black dress, Skinny Fiber works. Skinny Fiber lets you eat less and feel full. It's 100% all natural. It detoxifies the body, improves blood sugar imbalances, and melts away stubborn fat. Get yours today. For more information, call 901-860-5110. Or you may check out our website at www.skinnyuniverse.com.
Black Market TV.
All right, welcome back to I Heart My Health. Today we've been discussing Methodist North Spiritual Care Team. and the Congregational Health Network that leads and works very closely with it. We're joined by another special member of that group, Mrs. Sheila Easterling-Smith. Sheila served as one of our Congregational Health Navigators. Thank you so much for joining us today.
Thank you for having me.
We do truly appreciate it. Talk to us a little bit about the role of a navigator. What do you do on a day-to-day basis?
The navigator's role is to work with the hospital as well as the churches. And so what we do is when a person comes into the hospital who's part of the Congregational Health Network, my job is to make sure that their stay is smooth. Is it something that they need from the church? Then I will contact the church and make sure that they have it. I also work with health education programs. So if the church wants something dealing with sickle cell or lupus or hypertension or any health disparity, then I would work with them to make sure that they have the education that they need.
Wonderful. How long have you been in this role?
I have been in this role for 7 years. I was actually the first navigator.
Really?
And so they decided to do the pilot at Methodist North. And so Chaplain Chris Bounds, they sent him first, and then I came a few months afterwards. And so we started the program from scratch. And what a lot of people don't know is that we actually worked on it 2 years before we unveiled it. And most people don't know that.
No.
Yes, we had community leaders, we had pastors, as well as Methodist staff. And so we would meet once a week for 2 years to make sure that the program was something that would be something that the community would want. And so we didn't just want to unveil a program that the Methodist staff had thought of. We wanted to have the input from community leaders and pastors.
So important.
And so we did an organizational development chart. We talked to people in the community. We found out what was going on at Methodist South, because the actual concept started at Methodist South.
Right.
Really?
It was previous administrator Joe Webb worked at Methodist South. And so one of the things that he said was that, why aren't we an urban hospital? We got all of these sick people. So one thing about Methodist South is it's surrounded by dialysis centers. And so he decided to get a group of pastors to come in and discuss that. And so that was the impetus or the start of, at that time it was called the Church Health Network. And then when Reverend Gary Gunderson came as our senior vice president, he said in 2006, he said it was time to expand it. Why is it just at South? It should be at North University, Methodist, Germantown, and now Olive Branch. And so what we did was start the pilot at North. Let's just see how it goes. And so Chris and I did the very first clergy luncheon. And we were wondering how it would go over, and so we targeted, I think, 40, and we had 60 to come.
Wow.
Yeah, that was in March 2007.
Wow.
And so we started from scratch with no churches to almost 570 now.
Wow. Wow. So what is it, Sheila? What is the Congregational Health Network? Everybody's heard about it.
The Congregational Health Network is a collective effort, and so it's something that we're connected with the community, with the hospital, and with the churches. And so we have people that come from all over the United States and go, how in the world do you get all of these people to work together? We now have over 20,000 people who are registered in CHN from our various churches. And so the key is that people volunteer. The liaisons are the people inside the church that work with me. My role is a navigator, so I help them navigate. The liaison works inside the church, and we all work together. Let's see how we can help this person to have a better stay in the hospital. What do they need? Do they need prayer? Do they need to have their dog walked? I mean, it's very simple stuff. Even like you said about the eye drops, it's very small things that people need to help their stay to be better. So with the CHN, we're helping them to connect their faith and their health together so that they can be better. And so one of the things that we found is that there's a shorter length of stay for CHN patients. There's a lower cost as far as the insurance for those who are educated and know more. And it's just a better all around for those who are part of the CHN.
So it directly ties into what Chaplain Miller was talking about, making sure that the patient is not just physically treated, but also spiritually and emotionally as well.
Exactly, yeah. And one good example was we had a man in, and he had been married for 30 plus years, and I noticed that his wife wasn't there, and I was concerned. I'm saying, they've been married for 30 years, surely the wife would be here. And I found out that she didn't drive. He was the one that did all the driving.
Wow.
And so I contacted the pastor of that church, and he was like, oh my God, I did not know that. And so the Sunday school members took turns bringing her back and forth.
To visit her.
Yeah, and so his continence changed, he felt better.
I'm sure.
His blood pressure, everything was better.
Because his loved one was there.
Yeah, and it was something as simple as that. And so then we found out that she was worried about the dog. And so we got some of the youth at the church to walk the dogs.
Wow.
So, I mean, it sounds simple, but all of those things
All those things
affect
truly
how your health stay and how you do when
And how you
hospital.
convalesce, and how you
exactly.
heal. And that's what we're all about, is promoting healing. So talk to us a little bit about your background. How'd you get into the role? You've been here now, what, 7 years, you said?
7 years. Yeah, 7 years, a year completion. It actually started because I was working in the Faith and Health Division before as something called the coordinator for conference ministries.
Okay.
And so when pastors in the United Methodist Church have to go through this process, they have to have a physical, a psychological, they have to go through this whole rigorous process. And so I had training to be a ministerial specialist to help them through that process. And so when Dr. Gunderson came to Methodist Healthcare and he started having this vision of other things that he wanted to do, he asked me would I be one of the ones who'd be willing to step out on faith and just try this new Congregational Health Network.
That's fantastic. And how has it changed your life? I mean, we've seen you now in this role for 7 years. You've witnessed a lot of what the CHN can do and how powerful it is. Talk to me a little bit about what you've taken from it.
Well, it's interesting because when you look at something on paper, remember we were just looking at it on paper for 2 years.
Right.
So how is this going to live?
Yeah.
We kept hearing from other people, this is not going to work. You know, churches are not going to work with a hospital.
Right.
Nobody wants to hear from you. You know, we kept hearing all this negative. And so to see it go from paper to realization is just awesome. And just to know that you help people. One of the things about me is that I always like to help people.
Yes.
Even as a little girl, I was always trying to help everybody, make everybody better. And so it's probably not a surprise that I was
This is your calling.
This is,
I
yes.
was going to ministry. So it makes me feel good when I know that I've helped somebody to live healthier, to be better.
Sure.
Some of the people who take our classes say that they have been so blessed, or they may have heard a talk that we had and it was something that was life-changing for them.
That's wonderful.
So just being able to help people is good for me.
Well, thank you for all that you do. Your service is indelible, and I know you have made such a wonderful impact on our patients and our community and our primary service area.
Certainly.
Yeah. So thank you so very much for joining us today. Really appreciate it.
Thank you for having me.
Don't touch that dial. When we return, we'll close, and we've got some special insights for you. Jonathan and I will be right back.
Is your event powered by Black Market Strategies? Theirs was Black Market Strategies, the new face of urban marketing. Let us plan your next big event or design that special flyer. Black Market Strategies specializes in street team deployment, flyer distribution, target marketing, product and event promotions, marketing and brand awareness, campaigns and election strategies. But wait, there's more. Media relations and solutions, business strategies, community marketing. We promote people, product, events, and brands. Is your event powered by Black Market Strategies? Give us a call today. 901-379-9101.
Please support the Fresh Starts Community Baby Shower through your donation of a new baby item. I am State Representative Antonio Parkinson, and this is Kalani, and we approve this message.
Skinny Fiber works. I've got my Skinny Fiber. Have you got yours? If you need to drop 5 pounds quickly, Skinny Fiber works. If you need to get in that little black dress, Skinny Fiber works. Skinny Fiber lets you eat less and feel full. It's 100% all natural. It detoxifies the body, improves blood sugar imbalances, and melts away stubborn fat. Get yours today. For more information, call 901-860-5110. Or you may check out our website at www.skinnyuniverse.com.
Black Market TV.
Well, thank you so much again, Sheila, for joining us. Truly appreciate it. What powerful insights and just a wonderful background. I think this is a true differentiator that really services North. The fact that we have a Congregational Health Network. Right, Jonathan?
Couldn't agree more.
Yeah.
The work you've done, the way you've outlined it, I mean, truly speaks volumes to where we're going to go as an organization with you guys' support.
Absolutely. Executing our mission on a daily basis. Thank you. Thank you so much. Don't touch that dial. Jonathan and I will be right back with some further insights, and we'll round out the show. Don't move.
Is your event powered by Black Market Strategies? Theirs was Black Market Strategies, the new face of urban marketing. Let us plan your next big event or design that special flyer. Black Market Strategies specializes in street team deployment, flyer distribution, target marketing, product and event promotions, marketing and brand awareness, campaigns and election strategies. But wait, there's more. Media relations and solutions, business strategies, community marketing. We promote people, product, events, and brands. Is your event powered by Black Market Strategies? Give us a call today. 901-379-9101.
Please support the Fresh Starts Community Baby Shower through your donation of a new baby item. I am State Representative Antonio Parkinson, and this is Kalani, and we approve this message.
Skinny Fiber works. I've got my Skinny Fiber. Have you got yours? If you need to drop 5 pounds quickly, Skinny Fiber works. If you need to get in that little black dress, Skinny Fiber works. Skinny Fiber lets you eat less and feel full. It's 100% all natural. It detoxifies the body, improves blood sugar imbalances, and melts away stubborn fat. Get yours today. For more information, call 901-860-5110. Or you may check out our website at www.skinnyuniverse.com.
Black Market TV.
Welcome back to I Heart My Health. I'm rejoined by Jonathan Watkins, our COO. I'm Gyasi Chisley, CEO. What a powerful show today, Jonathan.
It's been amazing.
It's been,
I've worked with each of the individuals we talk to on a daily basis, but the opportunity to really hear them tell their stories.
And their backgrounds,
and their
right?
backgrounds.
Yeah.
Very, very, outstanding. Yeah.
Outstanding,
Yeah.
outstanding.
Very diverse, but all unique in that it led them to that common place, Methodist North Hospital, where we all get to treat, again, to your point earlier, over 400,000 people in our primary service area.
Absolutely, and not just treat them physically, but emotionally and spiritually as well, because that's truly what compounds our health and our health issues. What touched you the most about today's show?
Oh wow, a couple things, to be quite honest with you. It'd be one, the story that Ms. Billy Jones told about her journey to becoming a family partner. Again, having worked with the hospital well over 30 years, close to 40 years. Actually, yeah, close to 40 years. And then to go from there, being a patient with an aneurysm. Right. Again, having been diagnosed and being on the other side of care in which she provided, now to be a partner, giving back in another way. Her story, as well as Chaplain Steve Miller's story, hearing his journey to become the chaplain of the facility and a clergyman was outstanding.
That's what touched me. I mean, understanding Chaplain Miller's story, knowing that he was called, he even talked about, he sort of denied it at first. He's a duck and dodge, but even his family saw that his calling was in his heart. Right. And that's how I feel about us, too. I mean, healthcare is our ministry. It's our opportunity to really affect social change and social impact.
It is. I mean, we get the privilege, and again, I do consider it a privilege, to walk into the hospital every day and make decisions, help affect change, affect policy. It pretty much dictates, to some extent, how we'll make sure that the people that come into our facility are cared for.
Absolutely, absolutely. And to your point, we've got 400,000 people that we need to affect their lives and their health care.
It is, and it's truly a humbling experience to know and to lay down at night and know that you got that many people counting on you to make the right decisions, counting on you to make sure that Methodist North, which has been here for almost 40 years, is there for another 40 years.
Exactly.
Again, for our community, for the people here.
Standing on the shoulders of so many wonderful individuals, we are humbled by that responsibility for sure. Well, to that end, we talked a little bit about our Week of Blessing with Chaplain Miller. Yes. And that was such a historic event and series of events for Methodist Healthcare North. We were consecrated, our entire executive team was consecrated, but what stood out for you during that consecration in that week? I mean, was there anything that just sort of stands out as you kind of reflect on that?
Reflect a number of things, quite honestly. So looking out as we did, as we stood up and they did bestow the blessing on us and they prayed for us and everything. Having my parents there, my mother was there, and I'm such a good son-in-law that my in-laws were even there. Shows you about the relationship we have. But watching the emotion that they had, looking out and seeing that many people with their hands outstretched, praying for us, praying for the hospital's success, praying for the Methodist North leadership team. It I guess, gave me just a huge sense of, I don't even know what the word is right now. It was just, a huge honor.
It certainly resonated with me as well, Jonathan. I take that so seriously, and I was completely humbled and just flabbergasted at the support from the community and our CHN partners, Congregational Health Network partners, and everyone else that came into that wonderful service. And we had it right there on the front lawn. I really took, the same things. I got to see my family, my parents who taught me that I have a right to everything but entitled to nothing. I got to see, people that have supported me just in the short time that I've been here. And our executive team is fairly new, and that they've really kind of rallied around us and our leadership, hopefully capabilities, not abilities, but capabilities. What we will do has been just so humbling. And then we took that blessing, right? And then we didn't just, keep it and say, okay, we're going to keep this inside the hospital. What we did in the week of blessing, we took that blessing and shared it with everyone else. So right after that, we had our annual pastoral luncheon, where I think we had our highest number ever. Is that correct?
Yeah, it was close to 50 pastors and individuals representing the various churches, many of which, I think all of which, are part of our Congregational Health Network, come into the facility to, one, get a state of the union in terms of how Methodist North is performing, but also learn more about the state of the healthcare industry.
Exactly.
We're in a very transient time right now, so we wanted to talk to them a lot about that.
That was wonderful. Lots of rich questions, lots of good data. So we shared with them a lot. And then we took that blessing, and then we went into the community. We visited hair salons, we visited local businesses, and really talked to them about our mission, vision, and core values.
Yeah, and some of the things that we can do in partnership with them to not only strengthen their business and their entity, but also working with them on maintaining the health of their employees, making sure, again, that, to Gyasi's point, we get outside of the four walls of the hospital and really touch the people.
And then lastly, we shared that message with the wonderful children at Raleigh Egypt Middle, and just had a great message there and a great time. So that was our week of blessing, and that's exactly what we want to do. We want to make sure that through this broadcast that we're really bringing to you some of the things that we're doing on a daily basis. And our mission is not only living, but it's thriving.
It truly is. And again, we can't thank you guys enough for being a part of that. The people in this community really rallied around us, and we can't thank you enough.
So thank you so very much. Appreciate you tuning in. We'll see you next time.
Black Market Strategies. Black Market TV.
Skinny Fiber works. I've got my Skinny Fiber. Have you got yours? If you need to drop 5 pounds quickly, Skinny Fiber works. If you need to get in that little black dress, Skinny Fiber works. Skinny Fiber lets you eat less and feel full. It's 100% all natural. It detoxifies the body, improves blood sugar imbalances, and melts away stubborn fat. Get yours today. For more information, call 901-860-5110. Or you may check out our website at www.skinnyuniverse.com.
Is your event powered by Black Market Strategies? Theirs was Black Market Strategies, the new face of urban marketing. Let us plan your next big event or design that special flyer. Black Market Strategies specializes in street team deployment, flyer distribution, target marketing, product and event promotions, marketing and brand awareness, campaigns and election strategies. But wait, there's more. Media relations and solutions, business strategies, community marketing. We promote people, product, events, and brands. Is your event powered by Black Market Strategies? Give us a call today. 901-379-9101.
Please support the Fresh Starts Community Baby Shower through your donation of a new baby item. I am State Representative Antonio Parkinson, and this is Kalani, and we approve this message.